I don't think most lactation consultants like that term, in that it's really not so much about the nipple, it's about the flow. So we kind of reference it as flow preferencing. So a bottle is immediate, constant, often fast. And and a breast is not. A breast has to be suckled before it releases milk. And that may take, in the early days, a minute or so before milk flows. So that's a hormonal response called the letdown reflex, or in medical terms, the milk ejection reflex. When a baby suckles at the breast, message to the brain tells the pituitary to release oxytocin into the bloodstream. When it comes to the breast and hits the breast, there's a little muscle band around every cell in the breast where the milk is made, and it contracts that, just like it contracts a uterus for labor. So a baby has to suckle to get the release of the hormone, which comes to the breast and causes the milk to be released to the nipple area. So a baby who's getting lots of bottles doesn't know that, doesn't realize that sucking will result. And so you get used to that flow of immediacy, and then they're just pulling off, like, where's the milk? Where's the milk? So another concept is that the breast ebbs and flows. So that oxytocin surge happens, milk flows, and then that goes quiet. So our pituitary doesn't just pour it out, it pulses it out while the baby's sucking. So we have pulsatile response. And so the breast ebbs and flows, which is actually healthy for babies because it gives them a respite from the heavy flow, gives them a chance to sort of breathe, relax, because when the milk is flowing fast, it's kind of work, if you will. It's kind of work to keep up. So they get that relaxation, then they get another flow. And so when a baby doesn't have that, they're consistently on bottles that are constant flow and immediate flow, they reject. So that's what's called nipple confusion. So, and sometimes we have no choice. We cannot help giving bottles to some babies. They can't latch at first, or they're in the NICUs, or whatever the reason. And so we try to encourage moms to relax about that, but do the best they can to not use bottles in the first 2 weeks, if at all possible. And we're seeing with COVID now, we're seeing a lot more bottle use, a lot more. So because moms are leaving the hospital immediately, they're scared, they're worried. And so wherever we can, we say no bottles and no pacifiers, but we're not anti-pacifier. So we say, look, if you need to use one, don't get all whipped up about it, do it, but be sort of minimal as that baby's learning to suckle at the breast. We want lots of sucking at the breast. Even pacification is healthy at the breast. It's comfort for the baby. It's normal. When people say don't use your breast as a pacifier, I get upset, because it's one of the wonderful things about the breast is it can be used to calm your baby, and it should be used that way to, and it also helps drive milk supply, etc. So it's wonderful. So, I mean, you can always quit, you go to the bathroom, you get a sandwich, you can always take the baby off, you don't have to do anything. It's sort of, but it's not bad is what I'm saying.